Hi, my name's Ed Sipler from the Southeastern Trust's Addiction Service. Today we're going to talk about coming back from a relapse. Now, before we start, you decide how best to take in this information. If you're really unsettled, it might work better for you if you just close your eyes and listen to what we're talking about. If you choose to, you can follow the screen. How you use this is entirely up to you. And the important thing to say, what we talk about in this short presentation is, again, entirely up to you. You decide what's going to work best for you. So coming back from a relapse. Now, okay, you've had a slip. The important thing to say right in the very beginning, relapse is entirely normal. It's part of change. Relapse happens. Now, the bigger question, what are you going to do with it? It's like getting on a monotonous motorway, that highway that's going absolutely nowhere. Now, you can continue on that motorway for as long as it takes, or you can choose to get off at the first exit. The important thing to say is what you decide to do is entirely up to you. Now, what we're going to talk about in this short clip is how you see in this relapse. The way we talk to ourselves will greatly influence what we do. So how do you create a new conversation in your head about recovery? Is there learning you can have from this slip? Ride the waves of the aftermath of drinking or taking drugs again? And the power of positive support. What support can mean for you in getting back on track? And then having a plan that's going to work for you. And what it says on this slide, I'm not saying it's going to be easy. It's going to take work. But what I am saying, it's going to be worth it. How do you see your relapse? Do you see it as a slip, a mistake? And we all make mistakes. That's part of being human. That's normal. Okay, I made a mistake from this. I can learn from it, or can I move on? Or do you see it as a personal failure? I can't do this. I really messed up. So why not keep using? See the difference between how you would see that relapse? You see it as a failure, you're likely to keep on that path. If you see it as a mistake that I can learn from, it's a very different way to look at it. The way we talk to ourselves will greatly influence what we do. Now, the premise behind that, the idea behind all that is I learn what I believe as I hear myself speak. So if you talk in a very negative way, you're going to influence what you do. If you're going to be thinking, this is awful, dread, this is going to be miserable, it was horrible last time. If you feel that I don't have the energy for this, I'm too exhausted, or if you're loaded with fear, what if I do? What's going to happen if I fail? What's going to happen if this doesn't work? See how the way you talk to yourself will influence what you do? On the other side, how do you create a new conversation about recovery? What was good about being clean and sober? What do I stand to lose if I don't get back on track? What am I doing today to heal myself, to look after myself? A very important question to ask yourself, what do I want for myself, my life, my family? What is it that I really want? And when you look at a relapse, is there learning from that? Are you willing to look at your thinking, feeling, behavior that led to the relapse? If you are, you're moving toward recovery, not away from it. Now, a couple of questions you may want to think about. What did I let slide? What was working for me that I stopped doing? What did I want the drink or drugs to do for me? Build my confidence, help me cope, help me relax, help me block things out. Did that really work for me? What was negatively affecting my life that contributed to the relapse? People, places, things, my thinking. An important thing to think about, what could I do differently this time? Now, riding the waves of the aftermath of drinking or drug taking, if you started to drink again, started to use drugs again, your body could be adversely affected. Ride the waves, because chances are you are going to feel awful for a while. And what we've seen, see if you can relate to this, are common experiences people have after an episode of heavy drinking or drug taking. That racing brain, that washing machine brain that keeps just racing on and on. The inability to think clearly. Memory problems, short-term memory just seems shot. Mood swings, your mood's like a roller coaster going up and down with no controls. Fears and anxieties, a panic that things are going to turn out bad, that inner anxiety and dread that you tend to maybe experience. A restlessness, you just can't sit still. And that's going to affect sleep problems, trouble getting over to sleep, waking up early, combination of both, and being more sensitive to stress. Things you can cope with bother you that, rattle you that little bit more. And cravings, that inner drive that I need drink or drugs. Now, what helps? We call these post-acute withdrawal symptoms. They're post. They're after the drinking drugs is out of your body. They're acute. They're short-term. And people experience them. So what does help? Knowing that they're temporary. That expression you'll hear in AA and NA, this too shall pass. Know that these things do get better over time. Now, what can help speed up that healing? A good diet. You're feeding your body with the nutrients it needs. Physical activity. Endorphins, when you're physically active, are produced in your body. Endorphins lift mood. Routine, creating a bit of predictability to your day. And self-care, looking after yourself in ways that are going to help you. And support, building people around you that are going to help you, not hurt you. Now, support's really important to look at. Let's look at that a bit deeper. There is a clear link between positive support and not only preventing relapse, but coming back from it and your well-being. Now, how often do we listen to that voice in your head that's telling us, I can do this by myself. I'm strong enough to do this on my own. Real strength comes from being honest and asking for that support and help that is helpful. And the important thing to know, there is support out there. Now, your confidence, your belief in your ability is crucial here. Because if you're not confident, if you don't believe I can do this, you run the risk of talking yourself out of it. Well, I'll do this tomorrow. It's really not that important. I can't. If you're saying you can't, there's a likelihood you won't. Now remember, what we say to ourselves will greatly influence what we believe. So if you believe I can do it, I can give this a good try, learn from your experience. I've done this before. I've achieved things in my life before. That's going to build your confidence. Now, you'll hear this expression a lot, one day at a time. It's been around for a long time. There's Abraham Lincoln. He said it. Best thing about the future, it comes one day at a time. Do what's in your control today. Now, if you're talking about your use of alcohol or other drugs, well, what you do with that today is in your grasp, is in that control. So one day at a time, what can you today to move forward in your recovery is within your grasp. And to help you get through today, here's a little technique that might be helpful. It's called GLAD. 4 things. Think about the initials GLAD. G, what am I grateful for today? What am I grateful for in my life? Being clean, being sober. What's one thing I learned today? The L, learned. About recovery, about addiction, about myself, about life, about anything. Doesn't matter how big, how small. A is for what have I achieved today? What have I moved forward today? And even if you haven't drank or used drugs today, that's an achievement. What have I achieved? What's one thing? And it could be really small. One little task you got done. One little thing that you did to make today go better for you or looked after yourself. And D, what's one thing that delighted me today? Gave me a bit of pleasure. Now, it might be hard if you're struggling, but look for it. Those little things that just give you that little bit of motivation to move forward. Now, believing that there's help out there is important. Once you believe there's help out there, well, then you know it to be true. Now, you may want somebody that can just talk you through your next step with what you're going through. Now, there are people out there that can help you do that. In Northern Ireland, where we're making this tape, to look for services across the region, there's a website, www.drugsandalcoholni.info. That will give you all the support across all 5 trusts. Both Alcoholics Anonymous and Narcotics Anonymous are looking at creative ways to reach people. How do we reach people? Through Zoom meetings, through technology, phone calls, ways that you could get talking to someone. In our addiction unit in the Southeastern Trust, the Friends of Ward 15 have a range of meetings, on through the day, both relaxation and different recovery meetings and topic meetings. Go onto their Facebook page and you can find out where they are. And every trust has a recovery college, an opportunity to stand back and learn. And in these troubled times, they're looking at ways that they can creatively, build opportunities for people to do that. So the important thing to keep in mind, there is help and support out there if you choose to use it. The final thing I want to talk about is have a plan. How are you going to move forward? Who and what are you going to use for support? How are you going to take one day at a time? Get medical help if you need it. Your GP is a good port of call. But if you need medical help, don't be afraid to reach out for it. An important thing that is crucial for everybody, put the big stick down of guilt and shame. Mistakes happen. We all make them. It's more important what you're doing today than what you did yesterday. And see your relapse as a stepping stone rather than failure. Learn that what you can do now makes a difference, and things can be different for you. I hope that you're taking something from this. It gives you a bit of hope. Now, if you need a little bit more, another YouTube clip we have, if you Google my name, Ed Sipler, dealing with worry in difficult times, helps you deal with some of those fears and anxieties and points you toward other supports that might be helpful for you. Remember, whatever you take from this short talk is entirely up to you. But we do wish you well, and we hope you got something from that. And remember, there are people out there that can help and support you. Thanks for taking the time to listen to this, and we wish you well.